Hi everyone, warm welcome to you. So I joined in earlier just to make sure that the session is open so that once you click on the link you can join. So if you want to I'll just invite Jessica and the other panelists. You just need to click ask to share audio and video so that you can access the panel. And then once that is done, I'll hand over to you to run the session while I'll be there to give you all the support that you need. So welcome, Jessica.
Thank you so much, Charlotte. Can you hear me okay?
Yes, you are loud and clear.
Great. The only thing is it says I can't connect to my video, but that's okay.
So sorry. Probably with Hopin, you need to maybe give Hopin permissions. If you look on your browser, there is a little icon of a lock. So that has to allow Hopin to access your camera and your microphone. So I don't know if that is the hit. But whatever the case, it's okay. My video is turned off because of trying to avoid bandwidth issues. But I hope you're able to solve that.
Sure. No, it's totally fine. And I'll be sharing my screen for most of this session. So I think that we're okay. And I can see that it's easy to share my screen. Yeah.
Okay, so that's great.
I'm just going to be doing that now. Perfect. Can you see my?
Yes, we can see your screen.
Mm-hmm.
So, and for those who are in the room, if you think that you are not seeing the screen clearly, you just need to double click on the screen and to enlarge it. And as I said earlier, if you want to join the panel, so that if you want the possibility to speak, to share your experience, go ahead, click on the ask to share video and audio, and we'll be delighted to ask you to join the panel. Thank you very much, Jessica. Over to you.
Thank you so much, Charlotte. I want to welcome everyone to this session who's here. This is a quick 30-minute brainstorming session where we want to learn from you and hear from you in particular. First of all, a special welcome to the scholars and alumni of the IA2030 action plans. So I myself am a member of the IA2030 working group on immunization for PHC and UHC. But what is really amazing is that we have some scholars with us today who have prepared action plans to strengthen PHC and UHC as part of immunization. And we've been so delighted in our working group to be able to read through some of those action plans. And so we're hoping for your help today to get us started on building a conceptual framework. So in 2022, in this coming year, our working group, our IA2030 working group, will be developing a framework for action that helps all of us to strengthen PHC and UHC through immunization. So today we want your help to define what an ideal future looks like. And we want to think big. We purposefully are doing a brainstorming session to think big, to be really bold. And we'll do this through a few different ways. You can speak up. So please activate your audio if you want to speak up today. You can also type in the chat any ideas you have. And then the third way that we'll be interacting is by writing on the screen that you see in front of you. So my colleague Nana will share a link in the chat to this screen. And people can hop in here. We're hopping in from Hopin to a URL so that we can share ideas together and write together. So before we get started with our brainstorming and really thinking about what does the future look like, what future do we want to achieve together for immunization, PHC, and UHC, I'm going to invite my colleague, Falake Olenka, who's the co-chair of our IA2030 working group on immunization, PHC, and UHC. Falake, would you like to add anything today?
Thank you so much. This has really been an exciting time, and really we want to hear from you. And ensure that the very, very important and everyday job of ensuring children are immunized, no matter where they live, continues. We know that at the same time, getting the COVID-19 vaccines out as quickly as possible is a top priority everywhere, and we must equally do that. But we are trying to look at a bigger picture where we're looking at how we may strengthen the connection between immunization programs and primary health care, and linking this to the overall universal health coverage outcomes. So looking at that bigger picture, what do you see is the future? Again, we are co-creating this together, and we're really here to hear and listen to your ideas and thoughts. Back to you, Jessica. Thank you so much.
Thank you so much, Falake. So I'm going to just walk folks through how we'll do this brainstorming. We're going to spend 10 minutes on 2 different questions. And so first of all, Nana, I just want to check with you that you are able to drop our link into the chat so that folks can see and interact in this Jamboard. So this is a Google Jamboard. How this works is it's basically like a PowerPoint slide. It's like a document online that we can all interact with and write on at the same time. So again, you can either write comments in the chat or you can write comments in this Jamboard. The way that you add your comment to the Jamboard is, if you can see my cursor, I'm going to move it over to the left sidebar here. You click a sticky note and then you write your idea or your comments. You click save. And then when you click back to the board, you can see that your idea is in the board. So if you're still watching my screen, you can see that we add sticky notes in this way. At the top of the board here, you can see the different slides. So we're going to move to slide 3 now. And this is the first question that we would love your thoughts on and your ideas. So we actually want to look into the even further future than 2030, even though we're here from IA2030. We want to talk about, what does an ideal future look like in 2040? So even further out, where PHC and UHC are stronger, in part because of immunization. We would love your ideas. What does this ideal future look like tangibly? What are some of the outcomes that we want to work towards? This will really help us develop our theory of action or our conceptual framework on this topic. So I'm going to switch back and forth between my screens, but if you want to join this link, you can come into this Jamboard and add your sticky notes into this page on slide 3, or you can type in the chat or speak up. So do I have any volunteers who want to speak up and offer their ideas on what some of these outcomes are? What would our ideal future look like where PHC and UHC are stronger, in part because of immunization? And just checking, Charlotte, maybe you can help me with the chat, because I don't see a chat on my interface, but I'm sure there is one.
Yeah, maybe we can invite, I see Mamadou, I see Andreas Ateke. Maybe we can invite them if they're maybe to share some thoughts as well, and we can capture them in the Jamboard if they're not.
Perfect.
Yeah.
Mamadou, do you have any thoughts on this?
And please, you can click on the microphone icon at the bottom of your screen to unmute. I see Mamadou is muted. Let me just... Mamadou, you have to unmute, and Dr. Njo, you have to unmute as well if you want to share your thoughts. And unfortunately, it seems as if we have lost Dr. Njo. So I'm unmuting Mamadou. And others who are in the room, if you want to be able to speak, you have to click on the Ask to Share Audio and Video icon that appears on your screen, and then you'll be invited. I'll add you to the panel. You can add, and I see Professor McCartney has done just that, and she has been able to join the panel. So please, can you also just do same? If you're having bandwidth issues, you can cut your video so that you'll be able to connect without much difficulty. So let me see those who are already in the session. I can see that some names that I know. I see Anu Rotimi. Anu, you're an IA2030 scholar. You can. I also see Jenny. That's Jenny Sequeira from our team that's joining. So let me see if there are other participants in the room. That is alumni from the IA2030 course. Just asked to join. So Anu, I'm inviting you right now to join the panel so you can go ahead and unmute yourself to share your thoughts concerning the question asked by Jessica. So over to you, Anu. I also see Mohammed Abubakar Garba that has joined us. Mohammed, you can also ask to share your audio and video, and then I'll invite you to join the panel. So Anu, I don't know if you're ready. Over to you.
All right. Thank you, Charlotte, and greetings, everyone. Good morning, good afternoon, good evening, all. And I think the question that has been posed to us today is very, very important because it's actually something that we need to start thinking of. Okay, sorry, the sticky note is covering the question. Thank you. So the ideal future we'd like to see in 2040. First and foremost, I think the first thing we need to start working on is a very strong integration system. I look forward to a period whereby the primary health care system will be well integrated in conjunction with talking about supply chain. The supply chain needs to be well integrated. We need to start looking at human resource for health. Now, currently I'm speaking from Nigeria, and I'm a civil society person, and I've actually been part of quite a number of integrated supportive system. What we currently have on ground right now is not so robust, coming from a country whereby we still having challenges with human resource for health. And we've seen a case where there is overburden of health workers, and there's also shortage of health workers. So, and then we see that some health workers are not able to provide the necessary information, and we see so many caregivers or the mothers or the facility users having to go to several points to be able to access care. So we need to start seeing that point whereby people are able to access care almost at the same time. They don't have to go so multiple times. Before, for example, somebody wants to go for immunization, should be able to access information about family planning, should be able to access information about nutrition for his or her child. Then also another thing we need to start thinking about is the issue of health financing, care of cost. We need to start thinking on how do we cover costs. Health financing is very important. Like in Nigeria, how many of our population right now is are covered with insurance? How do we ensure that health insurance, immunization is covered under health insurance in Nigeria, which is the mode of health financing that we have adopted in the country? So these are key questions for me. So I look forward to seeing that by 2030, 2040, nobody will need to pay for out-of-pocket immunization services to be a part of it. And when we talk about immunization services, it should not just, for example, typhoid is not yet on the Nigerian immunization list. So we need to start looking at some of these other things. For example, they have the HPV is not yet on it. So we need to start looking at some of these things. Malaria is yet to be approved, and once it's there, will it be available, or we need to pay out of pocket for some of these things? So I look forward to a point whereby by 2040, all the essential immunization services will be well catered for under the health insurers. Thank you, Anova.
Thank you very much, Anu. Jessica,
Thank you so much, Anu. Those are great points. So we've captured there, I think the main one is that people are able to access care at the same time and don't have to go multiple times. That's an ideal future for us for people-centered primary health care, right? And your financing point that people don't have to pay out-of-pocket costs to access those essential primary healthcare services is also so critical. So I'd love to invite, we have some other folks on the panel who can speak up. Christine, I'd love to hear from you from the perspective of your region, what this ideal future looks like, where PHC and UHC are stronger, we're closer towards those visions and those goals, in part because of immunization.
Yeah, hi, thanks, Jessica. And I just wanted to herald that I'll probably only be able to stay on for another 10 or 15 minutes. It was a great session before. But I think coming from another angle, and I really love the access and integrated delivery angle, but I think also data systems, we really want to be able to use, population level data and have integrated digitized services ideally, but just some of the things that immunisation has been able to do in the pandemic, like enumerate, the population, where we've been able to try to understand who's in the population, who's getting reached, who's not getting reached. Some of these gains, I think, can help us as we try to integrate immunisation. I guess as immunisation works as an exemplar to strengthen primary health care, and having that data-driven approach to be able to really demonstrate where and how we're not able to, or we can strengthen universal healthcare at the same time. I think the integration and the partnering aspects for me still really do come through as well. Not working in silos, but sharing experiences such that we've done this time with immunisation. With this pandemic, we've sort of had to partner. It struck me so much that we've had to partner with just people we had never thought about ever working with in the past. And that partnering, whether it's my area is vaccine safety, for example, in particular. So whether we've been working with different types of specialists or different types of laboratories or different types of data points and all sorts of different types of advocates, people who we really have never worked with before. We I think have learnt so much from each other, and that integration, that shared learnings with primary healthcare, there is such a great exchange that can occur that will add to strengthen primary healthcare at the same time. So thanks for the opportunity. It's about 2:30 in the morning here, so I think I'm going to say goodbye, but thanks for the opportunity for a great session today.
Thank you so much, Christine, for joining us at such a challenging hour, but we appreciate your perspective so much. Thank you for these great perspectives by Christine. So I would love to move on to the next question. So we've already talked about what does this ideal future look like, and we have integration, we have people-centeredness that happens through integration, collaboration, not working in silos. I love Christine's point about what we can learn from data systems in immunization for the rest of PHC. Let's move on to the next question. So I'm scrolling over to slide 4 in the Jamboard. Again, if you're in this link, feel free to add a note yourself on any of these pages. So our next question is, what actions or enablers were needed to get there? So pretending we're far out in 2040 and we have this perfect integrated system, what was needed to get there? What actions or enablers? What did we need to do? So I invite you to again, join the panel so that you can speak up and participate. Thomas, I might ask you to get us started, because I know, so my colleague Thomas O'Connell is another member of the SP1 working group and has been thinking about PHC and UHC, of course, for many years and working on this topic. So Thomas, do you mind chiming in here, speaking up and brainstorming what actions or enablers were needed to get us to this ideal future state of PHC, UHC through immunization?
Hi, Jessica. Thanks, and thanks to all the participants. So I think the key that we would like to get from all of you is, what do you see at the two different levels? What do you see at the political level that might need to be addressed in really concrete, practical terms? And what do you see at the operational level that really is the main one or two stumbling blocks? So for both at the political level, is it awareness of the need to integrate? Is it a concern that maybe integration leads to reductions in coverage? What do you see as the two main issues? And at the operational level, what do you see as two things that are technical challenges that we really have to overcome together to see this kind of integration, to see the benefits and the synergies of working together to strengthen both primary healthcare services and routine immunization services within that framework? So I'm really hoping to get some advice and some ideas from the people who really understand this at the country level. Jessica, back to you.
Thanks so much, Thomas. And I see someone added strong political will, which is relevant for Nigeria. Really, really important point. We still have Anu in the panel, and Anu, as a scholar in this area and as with your civil society background, do you want to kind of elaborate on that piece a little bit about political commitment and political will for PHC and UHC, but also for, you brought up the point of integration. How do we generate that political will around integration?
Okay, thank you, Jessica. So from our own learnings from Nigeria in terms of strong political will as a concrete enabler, we've seen that the political will is important, because if you look at the four pillars of healthcare, which is you look at it from the federal, because Nigeria runs the federation system, federal, state, local government, and the world system. We realize that the healthcare system needs to be political will across all this level. We need political will to drive the change that we want and to sustain it at the same time. We need it in terms of ensuring that the loopholes within the system are reduced, in terms of ensuring that policies that are very viable are developed and implemented. We currently have what we call the Basic Healthcare Provision Fund, which is actually like an enabler and is the key driver for achieving UHC in Nigeria. So the Basic Healthcare Provision Fund is key here, but which was actually integrated in the National Health Act, which was passed in 2014. It, however, took us 4 years to get that part of the law implemented. And now that it has started implementation since 2018 to date, there is still a lot of issues around implementation. Even till last year, we've seen that there was a level of non-alignment between the federal government and the state government. The state government themselves are not investing as much they are meant to invest. The local government people are not also investing. So political will across all levels of care is very, very important. Now, in terms of integration, what can we really do to ensure that as a key integration? Number one, we need to strengthen our use of technology. ICT in healthcare should not be a choice, but rather should be mandatory for all of us. Now, in a country whereby we are, we are more than 200 million people, and we are very mobile, the use of technology will actually help people to reduce the burden on healthcare providers, and also reduce the burden on healthcare givers, because in the United States that people can simply walk into any community and access care, which currently is not happening. So we're still using paper-based and all those things. So there's still some loopholes. So ICT is a good enabler for us, and that will also help us to strengthen our data management in country. So I think for me, those are some of the key actions. Another action I think we can also leverage upon right now is the government policy that talks about the revitalization of 1 PAC per ward. The government have come up with, okay, we need to have at least 1 PAC in every ward, per ward, which is political ward that cover for about 50 million people, 50,000 population. So if we can have at least 1 PAC, but the other issue in terms of mitigation is that in terms of our referral system needs to be strengthened, because these PACs are not actually able to care for secondary care. So in terms of when they need to do referral, the referral system needs to be strengthened. There's still a very strong loophole in that system. So I think those are some of the issues I'm going to be highlighting as key enablers that can actually help us to get the kind of system we want to see by 2030, 2040 in place.
Thank you so much, Anu.
Thank you for the opportunity.
Yes, thank you so much for sharing. I see that Dr. Njo from Cameroon is with us, and Dr. Njo, you shared in the previous panel some really great examples of how you're integrating COVID vaccination with routine immunization. I wonder if you have ideas on what are the enablers or the resources needed to improve our integration of immunization and primary healthcare services. If you're able to unmute and share some of your lessons learned or your ideas, that would be great. Dr. Ateke, can you hear us? Are you able to unmute?
Okay, so Jessica, unmuted. Okay, Dr. Njo, over to you. Dr. Njo, please unmute. And while he's unmuting, I just wanted to also call upon, we have other scholars that are here with us. Mohamed Abubakar Garba, you can also ask to join. And we have Miriam Bello that is going to join the panel. Over to you, Dr. Njo. Please go ahead and unmute yourself.
Yeah, thank you so much, Charlotte. Thank you so much. I'm sorry I had some challenges with the internet connection. I could barely get the question. Please, if you don't mind, can you kindly repeat the question?
Yes, thank you, Dr. Njo. The question is, if we're trying to get to more integrated immunization in PHC, what are some of the enablers to get us there? And you had some great examples from Cameroon about integration earlier today. So what are some of those enablers to get us to more integrated immunization in PHC services?
Yes, I think one of the first thing is to identify the major stakeholders. For instance, in Cameroon, we have several programs that are already working with the community. For instance, we have the malaria program that has identified community health workers. We have the neglected tropical disease program that has, but unfortunately, the expanded program immunization doesn't have one. So that for us to fully integrate these community health workers in EPI activity, the first thing is to network with these other sectors of the Ministry of Health to get them fully involved and support the activity. Because most of the time, their activities, they have fundings that support interventions. For instance, malaria, when this team go out to work, they are paid per service delivered. But the EPI doesn't offer such services. So for us to get them in a routine basis to carry out activities, it needs that. They should consider it as part of their routine activities, though without any additional incentive to move on with it. And the second part of it, what we realize is we need to get the community actors fully involved. Firstly, getting them to understand the vaccination need, the important part that they play in the sector to be able to ensure that the population is immunized, and basically talking about childhood routine immunization, getting them to understand that these children are just the future of their community, of our community, are all elements that have helped in our context to be able to integrate these services. So in our setting in Cameroon, for instance, one other major element we identified was that because at some point there has been a lot of misinformation and disinformation. So one of the way we got about it was to work with all the local media houses, radio and television, and even with other bloggers on social media platforms. So we got them to, after briefing them in various fora, we got them to develop messages after they had understood the subject that will be adapted in their local context to be able to intervene in line with their local realities using local languages to pass across messages. And we think that gradually all of these have been tools that have helped us, and maybe if improved upon, they can be useful even more in our setting and in other contexts. So summarily for now, that is what I can say. Over to you.
Thank you so much, Dr. Njo. Community engagement is such an important pillar of primary healthcare and integrated people-centered primary healthcare. We only have 1 minute left in this brainstorming session, but we would love to share with you some of our next steps, especially for the scholars and alumni of the Geneva Learning Foundation. We want to continue to listen to you and engage you so that we can use your experiences and expertise in developing this framework for integrated immunization PHC towards universal health coverage. Flake, would you like to add something?
Yes, thank you so much. I think just to really thank everyone, and I'm wondering, Charlotte, I think we have the ability to stay on a little bit longer. Is that right, Charlotte?
Yes, Folake, we can stay a little bit longer. And while forgive me, let me just take a few seconds to say, initially the chat option in this session was not activated. That's why people could not share their thoughts in the chat. But we have just opened up the chat function. But for those who are not in the panel, you may have to refresh your browser. So if we are staying on, you may have to refresh your browser so that you can see the chat option and also type in your thoughts and your answers to the questions. Thank you, Folake. Over.
Great. Thank you. So Jessica, if we can stay a few extra minutes. I think there were 1 or 2 other people who, Charlotte, you were inviting to speak. I don't know if they are still on.
Yes, I see Miriam Bello. She's already here on the panel with us. So Miriam, I hope you're able to unmute. And there's Ikram Hamid that has just requested to join the panel. I've also just invited him. So Miriam Bello, I don't know if you're able to unmute. Okay, Ikram, you're already unmuted. So maybe over to you, Ikram. Ikram Hamid or Miriam Bello. You just have to click on the microphone icon at the bottom of your screen to unmute yourself, and you have the possibility to speak so we can hear you. Okay, Jessica, so far.
I think Ikram is on now. Sorry.
Yeah.
Ikram, will just give you another few seconds. I think you were able to unmute yourself. Do you want to try again? Okay. It seems there's maybe a little bit of challenge with the technology or network as well. But just to say that we really appreciate your thoughts and inputs today. It is helping us to co-create the IA2030 framework for immunization and primary healthcare. This is such an important crossover, I would say, for immunization, which has in many countries been almost like a separate program. But under the IA2030, the next 10 years, we really envisage having a much stronger, seamless integration, alignment within primary healthcare. And really, we're grateful for your inputs today. It's an ongoing conversation. So, again, we will be consulting with various groups and networking. Feel free to share with us your thoughts. And really, thank you so much for today. As we go forward, with this. We'll take all of this that you've given us to be part of developing a global conceptual framework that reflects your inputs and realities in the countries. Thank you so much. And with that, Jessica, I'm happy for us to close out the session. Thank you.
Thank you so much to everyone who was able to participate today and to the organizers. And we look forward, as Falake said, to continuing to hear from you and gain your ideas and inputs into this co-created conceptual framework. Thank you and have a great day at Teach to Reach. Bye. Goodbye.
Bye, Jessica. Thank you, everyone. So you
Bye,
can
everyone.
just click on networking if you want to go ahead and speak one-on-one with immunization professionals from around the world, or you can click on stage where you see live. You go to the stage if you want to listen to vaccine hesitancy case studies that were developed by members of the COVID-19 Peer Hub last December. So I, like Jessica just said, wish you a great Teach to Reach Connect experience.